All right, let's go ahead and transition to the last startup showcase, last but certainly not least. So I'm going to ask Lou and Ben to flip their cameras on. Lou filled in for me yesterday as the host, so you guys certainly got plenty of chance to get to meet him yesterday, but he's going to talk to you about a startup that he's been working on, Echo Healthcare. So Lou, I will hand it over to you and Ben and let you guys take it from here.
Okay, thanks. Thanks for the opportunity, Sean. And over the 8 or 9 minutes, what we want to do is really highlight an old problem that COVID has put the spotlight on. And I'm happy to say that Echo Healthcare has a solution for it. Also, as we go through this deck, I think I found at least 5 points that were made yesterday that were in this deck, sort of serendipitously. I'll try to point those out. And then secondly, I think this is the first time I've used this deck. So as that comes up, I would like to throw a question out the audience. Have you ever thought about loneliness? Remember I said I wanted to surface an old problem that COVID really put the spotlight on. I'll show you some data later from Cigna, where they sort of estimate that perhaps 1 in 2 employees in the workplace today are experiencing loneliness. And what's interesting is they've been tracking loneliness for the past 10 years, and it's gotten worse during COVID, but not significantly, interestingly enough. So it's been an issue. Well, you know, if you felt lonely, you know, what is that? Sometimes you feel left out on the outside, sort of invisible at work. And I think the remote work has just highlighted that. The one thing we would share is that loneliness is different than isolation. Isolation is more physical, and that's what the COVID has sort of surfaced. And loneliness is more psychological. It's really about connectedness, you know, and isolation can cause loneliness and vice versa. So I think if we look at the fact, loneliness is a pretty significant factor at work. And when you think about it, it's real. I mentioned to you, Cigna is reporting that maybe 1 in 2 employees are experiencing some form of loneliness. Let's look at a few more numbers in the next slide. You know, this, again, tracking this over 10 years, you know, 52% of the people report sometimes always feeling lonely. The 58, the 49, they sometimes experiences it. So, you know, it has a big impact on business. We looked at some of the numbers in the next slide that Cigna's put together, and they look at lost work days. And, you know, that's a significant number. Our partner Europe sees a number close to that, about 350 billion in Europe year, just in lost work days. When you look at mental health claims for during COVID, you know, it's just skyrocketing in most companies. So when you look at the increasing rate of healthcare costs to corporate America, mental health is probably the fastest growing segment to have. And if you look in the next slide, you'll see that the mental health, you know, yesterday, one of the points that came out yesterday with Dr. G and with Richard Citron, it's a big difference between mental health and mental illness. You know, what we're talking about here is psychological safety as people really try to get back into the workforce. And I think what you'll see, it's real. You know, Dr. G in the next slide pointed out that there's a clear correlation between loneliness and a key indicator in heart disease. And, you know, you see some of the other issues that loneliness can cause, but when you think 1 in 2 people in the US probably have a chronic disease, loneliness can be a key issue to creating comorbidities, as I just mentioned, like with heart disease. Everett Koop, the former, I think, one of the FDA directors, mentioned that loneliness can be the equivalent of smoking 15 cigarettes a day. So it's a serious issue. And what is loneliness? Let's just take a quick look at that, try to keep us on track. In the next slide, you'll see loneliness is really about being disconnected. unseen, unheard, lack of purpose. Think about how many meetings people were in and people seem unheard. Do I have a voice? And if you look at this, the interesting value proposition for many companies, when you look at loneliness, in the next slide, you'll see, there's a clear link between loneliness and inclusion. And you think about DEI and the tools that organizations don't have to deal with inclusion. You recruit, your diversity is one thing, inclusion is quite different. And when you look at the turnover, you think about the great resignation movement, how much of that is driven by loneliness, not feeling connected. And if you take a little bit more, there's good news. There's good news here. Next slide. We do know some of the drivers of loneliness. Look at the bottom left, working on projects not meaningful to organizational goals. How many people know how the work they're doing is linked to the overall goal? Low workplace friendships. I remember when the Gallup Q12 questionnaire came out, a lot of people laughed at the question, do you have a best friend at work? A best friend at work is one of the best predictors of retention of an employee. So let's nail quickly 2 myths on loneliness and then share an opportunity with you. The first myth is that, loneliness only happens to the quiet, the reserved team members. That's completely wrong. Even the most outgoing team members can feel lonely. You can feel lonely in a meeting in a room with 10 other people. The second myth, if we go to the next slide, is that loneliness only happens to people that don't have a stable social life or a family network. Loneliness is around more than you can think. And then finally, what we're trying to put together and what we're very interested in Echo Healthcare is we've put together a program, if you can go to the next slide, where we're trying to help people identify how much of an issue is loneliness in the workplace. We've worked with some folks from UCLA. There's some well-validated surveys there that can easily identify loneliness. And if you think about privacy, and we talked about mental health versus mental illness, this is an easy mental health discussion. We're not talking about depression. We're trying to talk about connectedness of employees. So the offer we have today is we're looking for 2 organizations to help us continue our pilot work on loneliness. If you're interested, you have my email or you have Sean's email. Thank you.